and the patient can go back to her doctor and get some help. The next scan is a abdominal scan. If we are lucky enough to open it up, yes, we did. We can report this. This is a urinary tract scan. In Brazil, it's called a urotomografia computadorizada. This is a 19-year-old female. It says she had her right kidney taken out. So I wonder what happened. Let's see if we can get some other kind of. It just says it might be a infectious disease case. It says she might have a abscess on the right side, the place she took out her kidney. Let's see if we have images. It seems this is a major case. Oh crap. It is a major case that wasn't done properly. It was supposed to be done with contrast enhancement, and it was supposed to be done as a abdominal CT, not a urotomography, because the abscess is a liver. It's a liver collection. It has right there. So, and right there, they didn't do a contrast enhancement, a proper contrast enhancement. So there is a stent, urinary stent right there. And this is just huge. This is a huge heterogeneous fluid collection. It's even hyperattenuating. Could be there is air fluid levels on such fluid collection, and it also takes a huge portion of the right side of the liver. There is pneumoperitoneum all over the place, and we have clear signs of diffuse stone disease of the left kidney. It's all destroyed by those stones, those coraliform calculi, and the parenchyma is very thin. This is probably a chronic kidney disease patient, and this is a very badly done scan on a very sick and young patient. That is also pleural effusions, bilateral pleural effusions, right there, with both atelectases and consolidations on the base of the lungs. Oh, this is so bad, so badly done. They didn't take off her metal monitoring devices, so it's filled up with artifacts. At least the appendix is fine, right? We have at least a moderate ascites. You can see free fluid right there. This should have been a contrast enhanced scan for sure. I can't really tell if we have two collections, one liver collection. This could even be a case of a diffuse liver infarction due to severe acute abdominal infection. It could lead to thrombosis of the portal vein and infarction of the liver, just like that. And liver infarction may have a fluid, air fluid level, just like that. It's possible. I'm going to measure this collection of fluid right here, and I'm going to measure this other collection of fluid right here. Clearly they had a lumbar surgery right there that went bad. So we have 1 and 2 collections. We probably have some kind of spleen necrosis, because the spleen is really heterogeneous, but it's so shaky I can't be sure. So I'm not going to risk that, because it's really easy to be wrong, and an exam is this bad. So we are going to be really brief and objective with such report. We also have enlarged retroperitoneal adenopathies, enlarged lymph nodes, retroperitoneal lymph nodes. It's right there. Just going to just write that down. 2.0. Just going to hit an MPR and measure those fluid collections, and I'm going to be as brief as I can. See, this is all necrotic liver. I really can't say this patient has any chances of surviving this. This is just way too serious, and it's really common on this kind of state-run hospitals in Brazil. Unfortunately, they just leave the patients to their own luck for days until they order this kind of crappy scans, and they do nothing, just wait for the patient to die in misery. It's really what it is. I'm sorry if you guys think I'm being harsh, but this is Brazil's healthcare in a nutshell right here. This is Brazil. Fortunately, I've seen thousands of cases such as this all over the country. This is what they do to patients that really need proper assistance. Unfortunately, let's just report it as quickly and as objectively as we can.